Good evening, everybody. I like to start on time, so if you agree, we're going to launch this 1 hour and a half meeting today. So thank you, first of all, for joining this afternoon, especially my students. Very nice to see you here. And of course, all the Sciences Po students who are with us today. So I would like, first of all, introduce this session, saying a few words. Number one, why we're doing this at PSIA, and it's very simple. We have, with Katerina, I think a lot about, is it evident for you, Sciences Po students, that global health and climate change, environment are two topics strongly connected or not? And we had some doubts about this, saying probably in the last years, even if COVID has been on the top of the international agenda, we have also a very, very big crisis coming behind that. It's the climate change crisis. And we have seen, in your choices, that a lot of you are very interested, very passionate about this climate change crisis, but you don't always see the connection it can have with our health ecosystem. So thinking about this with Katerina, we said it would be nice to invite some colleagues to present what the global health actors are doing against, not only against climate change, but to address climate change impact today in the field. So that's why we're very, very happy to have here in Sciences Po in person Vanina and Serge, and I will present them after, but also from Asia, Neelika, who is today, if I'm not wrong, in Thailand. She's from Sri Lanka, but she was in a workshop in Thailand. So thank you very much, Neelika, because it's very late for you, and you accepted to join. And we have also a colleague in Montpellier who work in a research institute called CIRAD, that will be joining also by Zoom, okay? So that's the reason why we're here and why we have invited our 4 colleagues to be with us. Second point, just a quick introduction on the definitions. And I think that's also an important point for you, because I used, for instance, global health. And global health is a definition that finally is very recent, just early 2000. And in the past, we used to talk about tropical health or international health. So we tried with this global health to, let's say, open this space of research, of intervention to a very pluridisciplinary and multi-actor approach. So that was a sort of first step in this. But we realized that it was not enough. And that probably we should also think about the environment where we're working. And you will see that some academics and some organizations are talking today about other definition, planetary health, for instance, that really, let's say, try to have a comprehensive approach of all the planet health. And maybe the one that it's more popular today is One Health. So I would like just to give you this definition, what is One Health. And I took a report that was done by the 4 UN agencies working today in One Health. WHO, the World Health Organization for human beings. OIE, that is sort of WHO for animals, based here in Paris, not so known, but important for you to know. The third one is FAO, working on FAO, working on agricultural and animals. Animals, when you think about food. And the fourth one is UNEP, working, of course, on environment. So those 4 organizations define today One Health as an integrated, unifying approach that aims to sustainably balance and optimize the health of people, animals, and ecosystem. And I think those 3 keywords are really important for you: people, animal, and ecosystem. The 3 together brings this One Health definition. It recognized that health of humans, domestic and wild animal, plants, and the wider environment are closely linked and interdependent. Okay, so if you remember that, you will see that the different examples we're going to talk about will try to address sometimes the 3 together, sometimes both. For instance, when we talk about some pandemic threats like COVID, it's really the, let's say, not opposition, but the junction between human health and animal health, because as you know very well, it is a virus going from animals to human. We call that also a zoonose, okay, when you have a disease going from the animal to the human being. So this is one way of talking about this, but hopefully you can have also the 3 of them together, and I will invite you to read. It was launched just today, so it's a coincidence. We didn't choose the date for that, but a very important report from the UK journal called The Lancet. Some of you have heard about it. It's one of the most important science journal, The Lancet. And you will see every year they do a report on climate change and impact on human health. And it was really launched today. So I took it a little bit to share with you some numbers that are in this report. And you will see, first of all, that all the scientists working here insisted that the COVID crisis, the Ukraine crisis we have today, and of course the consequences, energetic, economical, have, let's say, escalate the climate crisis we have before. What is, I think, really key for you to understand is that the health system that are supposed, to address all the human threats have been completely weakened by those multiple crises we are having together. Secondly, it's very interesting if you see some numbers. For instance, if we look at the energy crisis, we have millions of people that will not have access to energy, that we need for, first of all, your homes, or to have a healthy temperature. So imagine, and you know that well, maybe when I was a student, I tried to do some savings on the heat in my apartment, that when you abuse a little bit, you, of course, will have an impact on your health. So we can manage, hopefully, because we're here in Paris, but when you are living in places where you cannot manage this, the impact can be huge. It can have an impact, for instance, in the capacity to preserve drugs that need to go to the fridge, or to use in hospital everything that is related to energy. So the impact a lot of countries are having on this in the health system, it's absolutely huge. Second, and I was very shocked about this, we have seen an increase by 68% on deaths that are heat related. So really the global warming in between 2000 and 2017 have bring 68% of increase on death. And we can also think about food. Maybe Serge, who is also a specialist on food crisis, malnutrition, etc., will let you know. Imagine those crises coming, and you have seen, the capacity for people to get food, what are going to be as consequences for health. So if we addition, and again, I invite you to read this article, all of that, you could be, let's say, a little bit anxious And I was thinking about Bruno Latour, because probably you have heard a lot about him those last week after he left. And he used to say that he thought it was a disconnect between the science and the size of threat that people mention about nature, about the planet, and about climate, and the other way, how the emotion, those different elements are being triggered, by everyone. And so he said, I suppose, that you will be extremely frightened people, but despite that, you appear to sleep pretty well. So I said, okay, one of the objectives today will be that tonight you will not sleep pretty well, because you will be conscious about that. But I hope that it's not going to be just anxiety, because there are also evidently some reasons to have hope on this. And the article of The Lancet tried to insist here. For instance, saying that country leaders with a record of 60% of 194 countries focusing their attention on the links between climate change and health in the last UN general debate. So there is a political conscious. There is also interesting an important increase on the coverage by media on health and climate change, with an increase of 30% since last year. So we see that this is coming. And even at the city level, for instance, we have more and more local authorities that are identifying risk of climate change and health for population. So we see also that local politicians are really taking that much more into account. So that will be your role in the future after leaving Sciences Po. So we really, of course, count on you for that. But to get a little bit inspired on what you can do at your position with your Sciences Po background is the reason why we invited our 4 colleagues to share their experience with you. So I want to just stop here and give the floor now to Vanina Ledru, who is the director of the foundation Sanofi. You probably know Sanofi, one of the most important pharmaceutical companies in the world. They have been working in several types of diseases, infectious one, diabetes, cancer, non-communicable diseases, and all around the world. And they have a foundation that, with Vanina now, is taking, let's say, a new dynamic. And one of the most important things this foundation have decided to address is climate change and consequences on human health. So thank you very much, Vanina, for accepting the invitation. We're very happy to have you with us. And I will give you the floor to present a little bit what the foundation is doing now.
Thank you so much, Luis, and thank you, everybody, for coming here. It's very important for me to address this audience, to address young people. So if you read the Lancet Countdown, the article that Luis was mentioning, indeed there are glimmers of hope that are mentioned. In my case, my glimmer of hope is that I'm here and that I'm hoping to turn more of you into advocates for the nexus between climate and health. And it's great that it's plus 30% increase in media coverage, but we were starting from zero almost. So it's a good starting point that we're having this discussion here. So Foundation S. Foundation S, the Sanofi Collective, is the new philanthropic engine of Sanofi, the pharmaceutical company. And at Sanofi, 100,000 plus people company, we've decided that it was high time to ensure that what we do on social impact should be extended and should be core to our commercial approach as well. So as a consequence, we have decided to refine and extend our approach, which is now based on 3 pillars. First, we have a corporate responsibility shop, as in any company, and we work on access, we work on the environment, and I can detail this in more details, but we also work on things that are very important, like diversity and inclusion. And I hope that for some of you that potentially are interested in joining us one day, this will also matter to you. Next, we have created a global health unit which aims at selling at no profit, no loss prices 30 of our medicines to the 40 poorest countries. And we call this our social access to medicines. But we've also quickly realized that for the most vulnerable communities, it was very important to ensure that we could have another way of giving access to medicines, and that we could also extend our commitment to society. And that's why we created this new foundation. We had a foundation that had been active for 10 years, but it was coming to an end of an investment cycle, of a strategic cycle, and so we've decided to completely revamp it. And now Foundation S is structured as a think and do tank. And why does that matter? I'm starting by the how before the what, because for me the how is very important. It's very important because we're called, and maybe it's on the slide, Foundation S, the Sanofi Collective. So the think tank is something that we're putting together, an external committee of really wise people to advise on our strategy and how to implement it. And they will focus first and foremost on health and climate, and I'll come back to it. And then we have a do tank, and the do tank is with the 100,000 plus employees that we have, how can we ensure that we can also benefit from their expertise, that they can also commit to support organizations that we give grants to, and this is already happening. And next, on the how, what we aim at doing is really to improve the lives of vulnerable populations by catalyzing community-based solutions and expanding access to medicines. So we focus first on childhood cancer, not the topic for tonight, so I will not spend too much time on this. Then we've decided, as Luis has said, to place a very decisive focus on climate action and health resilience, and I'll come back to it in a second. Third area is something on which we are partnered with Drugs for Neglected Tropical Diseases Initiative, DNDi, which Luis heads, sleeping sickness. We're committed to eliminate sleeping sickness by 2030. We have worked in partnership, and partnership is really the key word in the One Health approach, to ensure that we can again eliminate for the first time in the world history a disease without a vaccine. And if we succeed, it will be a massive public health success. And finally, cross-cutting is everything we do for humanitarian aid and medicine donations. We're really trying to move from a reactive to a proactive approach here. And what Sanofi and the foundation are doing is to ensure that we not only give drugs and vaccines when natural disasters strike, but that we can now work again in partnership with the global community to better predict the unpredictable. How can we together elaborate an emergency preparedness framework? How can we work together to ensure that we have the right stockpiles for medicine that will be needed in urgent situations? And so since the last 6 months, which is the date when we've been launched, so as you can understand, we are a baby in global health, we've given 38 million euros worth of financial donations and medicine donations. And we've intervened in countries like Pakistan recently due to the floods. So this is also very much connected to the impact of climate. So coming to climate action and health resilience. Why are we here today? I think it's very timely, not only for the Lancet article that we hear, but also because COP27 is around the corner. And at COP27, global leaders will come together, and they will discuss what have we done since COP21. I think you all know the answer. Not much. Where's the financing? Nowhere to be seen. Africa is only 4% of all the global emissions. Have they received the $100 billion that were promised to them? Not sure. So the discussions will be very heated, and that's why I think it's so important that civil society advocates, public-private partnerships can also be around the table and constantly remind everybody climate change is killing people every day. It's killing people mostly in the south. Today, we're only giving 0.5% of the entire climate financing to health programs. What does it mean? In my mind, and I know I'm being provocative and surely not politically correct, but it means that we have a colonial approach to climate change. It means that we're simply funding mitigation programs, which is not simple, and it is not simply. It's a lot, but it means we're not funding adaptation. For many countries, especially low and middle-income countries, climate change is a reality. It's the way people live every day. And they need to adapt their healthcare systems. They need to continue to ensure that they have access to care, to prevention. And they cannot do this when there are floods. They cannot do this when there are fires. They cannot do this when their livelihood is threatened because salty water is now everywhere. They cannot do this when the, again, hospitals are under heat wave and nothing is working, as Rhys was saying. This is a very real example. And so that's what we're discussing today. How can we ultimately contribute through philanthropy, which is what I do, and it's a tiny percentage, but how can philanthropy step up to the fight of climate change? Today I'll give you another stark figure. Only 1% of the entire global philanthropy is going to climate change. Why is that? The issue is it's too complicated as an issue. It's too multifaceted. It's too structural to every issue. And so it's not easy to measure what you're going to do. And at Foundation S, we've decided that it was not going to be easy. It was not going to be easily measurable. We're trying to do our best to have direct and indirect impact measurement. And we'll welcome questions and really challenge to ensure that we can do something about it. But really, I invite everybody to address the NGOs, the foundations that you know next to you, to also join the fight, because we need to be together in working on that. So in closing, I just want to say, again, you're my glimmer of hope. We are working every day in partnership with many other actors. Discussions are not easy on this theme. We were actually together at the World Health Summit, where it was very interesting to observe, similar at the United Nations General Assembly Week, and similar to many other recent discussions, that there was a climate track and there was a health track. And what we need to do is simply bring the two together. So the One Health concept, if you want to call it One Health, planetary health, doesn't matter, brings the two together. Without a healthy planet, it's impossible to have healthy humans and healthy animals, and that's really what this is about. So Foundation S, again, is really extending a hand and trying to do its tiny part. We know it's only a tiny part, but I believe that all drops in the ocean always matter.
Thank you very much, Vanina. And I would like maybe, because I didn't at the beginning introduce Savannah, who is going to help me to chair also this session. Savannah is a student here at PSIA. She was my student last year, and she is still doing an internship. Yeah, I will let you explain where is your internship, because it's related to One Health, and she accepted to be with us also today. I thought it was interesting for you, of course, to hear this experience from Savannah. So Savannah, I let you maybe say a few words.
Thanks, Louis. So hi everyone, I'm Savannah. I'm also doing a master's here in environmental policy. I'm in my second year and I'm doing the internship track. I'm at the One Sustainable Health for All Foundation. It's a small foundation based in France, and I'm the project officer for our One Europe for Global Health coalition. And we're really trying to work on bringing One Health and global health together. I was also following the World Health Summit a bit last week, and One Health was everywhere. And I think the main challenge right now is just the implementation of this approach, because no one knows how to do it. Because it's not a new concept, it's actually a couple decades old, but everyone's kind of catching up since COVID to the idea of One Health and how important global health is, or how it's related to our environment and to animal health. And I think now everyone is kind of seeing the importance of that just because of the drama of COVID. And I just wanted to say that it's not just COVID, but a lot of other infectious diseases. That's why we're talking about pandemic preparedness now and surveillance. But even beyond just infectious diseases, there's so many ways that human health is related to environmental health, such as AMR, even non-communicable diseases that are worsened by the effects of environmental health, like air pollution as an example. Just wanted to say that One Health is everywhere, And our environmental health is really related to human health. I just wanted to follow up with what you said, Vanina. I thought it was really interesting that you said this approach we have to climate change is colonial. Maybe you could expand on that a little bit. And yeah, I think, yeah, that was just an interesting statement.
So, sure, maybe I'll give you first a stat to start with. There's a UNICEF report. Now all UN agencies are really doing their best to assess what's the impact of climate change on the topic that they focus on. And UNICEF, you may know that they focus on the well-being of children. And their recent Children Climate Risk Index reveals that 1 billion children are at extremely high risk of the impact of climate change on their health. Where does this 1 billion children live? 100% live in the south. They live in Bangladesh, they live in Pakistan, they live in Africa, they live in Latin America. And the reason why we're not seeing and feeling maybe some of those impacts is because when you live in countries that are not yet fully impacted by climate change, you don't realize that your everyday life is changed. But for those children that are not 18 years old yet, they're all to grow, they are the future holders of this world. It's a stark reality. So that's what I mean by colonial. It's because you really have to ensure that in the end, the funding that is governed by institutions and leaders that sit in the north, for lack of a better word, is redirected to those that live in the south because they're feeling the effects of climate change now. And that's the conundrum, right? You need to do both at the same time. Will there be enough funding? Evidently not. So what do you prioritize? Do you prioritize the health and well-being of children that live in Europe, in the US, in North America, that are impacted by the epidemics of obesity, more diabetes, NCDs, that non-communicable diseases in general that cost billions to healthcare systems? Or do you address the impacts and that are already taking the lives of people in the south? And there's no perfect answer, but I think we're here to make sure that the questions are asked and that those that don't have a voice in the system, because that's what's happening, they're not at the right table, they're not at the decision makers table, that they can be heard, and hopefully that at COP27 some of this funding can be redirected, because that's the huge failure since COP21. COP21 was full of promises. I think you were there, I was there, many people were already there. And since then, it's been a trickle going to those questions.
Yeah. Yeah, the reason why I asked is because I think sometimes we're criticized for putting human health above environmental health or animal health. So like 0.5% of the climate budget being dedicated to human health might not be a bad thing in some people's eyes, but I think you're right that we have these basic needs to meet for humans across the world, and especially considering this dynamic of north to south.
I think this is a great point that you raised, because one thing that we don't necessarily consider is why does it matter to protect human health in countries disproportionately affected by climate change? It matters because if we do not protect their health, then what happens? They move. They move to slums or suburbs in cities, creates more pollution, creates more pressure on the ecosystem, creates rarefication, anyway, less animals. So that's what's happening as well. So it's not a question of putting human health above else all. It's also a question of ensuring that by working on human health, actually you help the health of the planet and of the animals.
Great. Now we're going to present our next speaker. So we have Neelika Malavige from Sri Lanka. She's the new head of the Dengue Global Program and Scientific Affairs at the Drugs for Neglected Diseases Initiative, DNDi. And she'll be speaking on her experience on dengue.
Thank you for inviting me, and thank you, Louise, for having me. I can't switch my video on for some reason. The host has stopped. Okay, yeah, all right.
It's not possible to turn the video on? Yeah.
Yeah,
it's
okay.
Much better if we
thank
can
you.
See you.
So thank you, Louise, for having me talk at this very important discussion about climate change and how it affects global health. And so the students must be wondering why dengue is relevant to climate change and why we are talking about dengue today. And many of you might have heard of dengue, but really not aware what dengue is actually. When you're living in countries which are not affected by dengue, merely because the mosquito which transmits dengue is not present in temperate climates. So just to let you know a little bit about dengue, it's one of the most rapidly emerging mosquito-borne diseases. And if you actually Google and read what is the animal that leads to the highest deaths in humans, it is the mosquito. And so dengue is transmitted by the Aedes species of mosquitoes. And these Aedes species transmit other virus infections apart from dengue, like Zika, chikungunya, and so on. But dengue is most important because numbers-wise and impact-wise, dengue causes much more devastation than any of the other viruses transmitted by Aedes. So now, when it comes to climate change, why is dengue important? So I'll talk about a little bit about how bad dengue is before I talk about climate change and dengue, so you understand what sort of infection we are talking about. So it's because the mosquito is present in tropical climates and subtropical climates. It causes around 390 million infections every year, of which about 96 million infections are symptomatic. And of these 96 million infections, quite a large proportion are hospitalized, and about 70% of these, the burden of dengue is in Asia. And so most people who are supposedly having mild dengue have really bad body aches, muscle aches, joint pain, headaches, loss of appetite with high fever, and even the so-called mild. So people who are called having mild infection are those that do not require hospitalization. But even after a week or so of fever, many find it difficult to return to their day-to-day activities in the week after and for like 2 or 3 weeks, and because of severe fatigue and not being themselves. And the ones who do get admitted to hospital, they have to be very closely monitored for development of severe dengue, which can be lethal. Now, because we know how to manage dengue better, the mortality rates have declined in many countries. But when dengue was initially seen in a country, then you don't really know how to manage dengue. The mortality rates are around 10%. So we are talking about very high mortality rates. And the reason that it's lower is because we understand the infection better. Now, how does this infection relate to climate change, and why is it important? Well, as you know, because Europe had very high temperatures this summer, record high temperatures, after many years, or first time in some regions in France and Italy, there were a few dengue infections. And this is because with climate change and rising global temperatures, the habitat of which these mosquitoes are expands. So the dengue mosquito circulation, the geographical regions expand. And it's not only, so it doesn't mean that, okay, France and Italy and other European countries are likely to now face the threat of dengue because of global warming. It's not just that. Most importantly, in dengue endemic countries, so we are talking about countries in the tropics and subtropical regions, which are mostly low-income countries or lower middle-income countries. The dengue incidence in these countries is markedly increasing. So if you look at the last 30 years, the dengue incidence, age-wise dengue incidence has markedly increased. The disability-adjusted life years has increased. The mortality rates have increased. So it has caused significant impact because with the rising temperatures, the mosquitoes mature faster so they are available for a longer time to cause infection. And also the mosquito larvae mature into adult mosquitoes faster, and therefore you have higher vector densities. So it's not just the temperature. So I think you're very aware of the situation that happened in Pakistan this year. There were terrible floods, which, as all of you know, was a result of climate change. And because of this very erratic weather, with massive flooding, as soon as these floods start receding, then you have dengue emerging. So a lot of dengue has become quite worse in a lot of dengue endemic countries. And if you compare dengue with COVID, I'm sure you saw during COVID times the hospital systems becoming overwhelmed. The European hospitals, US hospitals, all these hospitals in developed countries could not cope with the large numbers, and you had tents outside and so on. So this is the type of thing we experience every year in every dengue season in dengue endemic countries, and that's how bad it is. And because it's a neglected disease and it doesn't affect high-income countries as of yet, we still don't have a treatment. This is what I wanted to say about how climate change can affect global health and especially vector-borne diseases because of rising temperatures and the erratic weathers. Thank you.
Thank you very much, Neelika. I think you have here a very good example of something really concrete that unfortunately has bring attention from the media, because, as Neelika said, this summer we had a small outbreak of dengue in the south of France, so people realized that was a reality all around the world, and not just let's say in the tropical countries. But Neelika, maybe it would be interesting to say a few words about other diseases, because there is not only dengue that will be impacted by climate change. What are the other diseases that are threatening, let's say, the most fragile health systems?
Yes. So apart from dengue, so I mentioned a few other mosquito-borne infections, Zika and chikungunya. So if you remember, Zika caused quite a lot of issues in Latin America, especially with fetal malformations. And Zika was actually discovered in the 1950s in Africa, and it didn't cause that much of threat until recently. And again, Zika is spreading very fast because of the higher densities of vector, and the vector becoming more competent in spreading these mosquito-borne infections. So Zika is one infection. Chikungunya is another terrible infection spread by these mosquitoes. It really causes, apart from the extreme fatigue, fever, and joint pain, a significant proportion of individuals have long-term disability because of arthritis, arthralgia, even up to 1 or 2 years, arthritis. So we are talking about swollen joints and inability to do normal exercise and normal physical activity that they've been used to. And the other viral infections that are spread by mosquitoes, which we're talking about, are things like really dangerous ones, like West Nile viral infection, which is transmitted by the Culex mosquitoes, and then Japanese encephalitis. Then you have other vector-borne infections like tick-borne encephalitis. This is one of the reasons of climate change, of course, is rapid urbanization and deforestation. So as more and more forests are cut down, and gives the ability of more and more human and unusual animal interaction, we are likely to see more and more zoonosis in future, causing pandemics.
Absolutely. Thank you, Neelika. So I think it's good for you, if we want to be very simple, to get that we have two approaches, let's say, in the health sector. First of all, the health sector contribute to around 5.5% of the global emission on carbon. So just thinking what we can do to have less carbon footprint in our activities, it's something that the health sector can do. For instance, how we produce at DNDi with Neelika, we try to develop new drugs, and thinking how those new drugs, the way they are produced, will have a less carbon footprint. It's something we can bring to this fight. If you work, for instance, in the laboratories, thinking about the waste management. You know, you go to the lab, you have some blood tests, etc. What are you going to do with the waste? How are you going to manage this? And what is the impact that on the environment? So that can be some elements that the health sector can do in one side to address. And the other one is what Neelika was saying. I mean, we have diseases that the burden of those diseases will be every year higher and higher. So we need to produce and to find new tools to fight against that. And it's not only about vaccine, it's also about treatments. And that's why with Neelika we're working together to try to bring new drugs for that. Because in low and middle income countries, we know that the burden of those diseases will be very high. So this is one type of response. And I would like now to give the floor to Serge Breysse, who is also teaching here at PSIA a class called Non-State Actors in Global Health. I really recommend you for the second semester. And he's the director of an NGO called Solthis that is working mostly in West and Central Africa around infectious disease, sexual and reproductive health, but also health system strengthening. And they have a very, very interesting project. So Serge, up to you to let us know a little bit more about that.
Thank you, Louis. Hi, everybody. How difficult it is to talk after all those very interesting and brilliant speakers. So I'll try to do my best. Thank you for being here. I hope you're here because you're concerned. I hope you will sleep tonight, but get outraged, because that's what it deserves. That's what happened to me a long time ago, and that's why I'm working in this international solidarity sector since too long now. I'm a doctor by training. I am the CEO of Solthis. Solthis, as Luis mentioned, is an NGO working in West Africa with permanent team in 6 countries. Few things on what we do, because it will come back in my presentation later. We always work on partnership. We create synergies and network, and we never do any substitution. We are supporting local and national actors in the countries where we have projects. And we always have research and advocacy in our project, and you will see a bit later why this matter in my presentation. If you want to know more on Solthis, you can find it. I know you're very good to go on Google or something. So I will stop there, and I will focus on what is the subject of today, One Health. Actually, it's true that with all what has been said before, you can see that if you do work on health in Africa, especially in the Sahel region, you always work on topics that are related to climate change. But what we try to do with One Health is a bit different. It's having intervention that are really at the intersection, as Luis mentioned, of environmental, human, and animal health. So in this frame, we did a program. We have a program now in Haute-Casamance in Senegal, in the Kolda region, a region with 60 to 70,000 inhabitants. And it's quite a poor region of Senegal, close to Gambia and Guinea, and where there is a lot of trade, a lot of movement of population, but as well a lot of cohabitation between human, animals, forest, and where One Health has really a reason to be. The objective of the project is to contribute to the resilience of population in global health issue, trying to improve the 3 components. So that's quite challenging, because very often, as we can see in a lot of the presentation, we try to address through one lens the impact on health, on human health, or the impact on animal. The objective is really here to look at everything. We do it with, in partnership with AVSF, Agronomes and Vétérinaires Sans Frontières. So we try to apply also this idea of breaking silos in our partnership. We do it with CASADES. It's a national Senegalese NGO who is strongly linked with local actors in the region. Actually, it's an old NGO that has been created in the 90s when there was the Casamance fight for independence, and they were supporting peace efforts. So they started really by engaging dialogue with community. And we also work with CIRAD and some Senegalese academics. You will see later why, because we think it's important that we document what we do. And as you mentioned, the Savannah, the idea of One Health is old, and we really need to find solutions and demonstrate that those solutions are working. That's why we always put this kind of research or analysis of our project. What are we doing? It's a bit strange to tell you that, but what we do is more applying a methodology, having a process to make sure actors that are stakeholders that are concerned by those three areas can talk together, work together, and find solutions together. We want this to be very localized, so for me, it responds to the objective of international solidarity today, localization of aid, trying to find very specific solutions, Never apply global solution coming from Paris, Geneva, or somewhere else, Washington. Just make people work together on finding their own way to find solution to their problem. So for example, I will mention a long list, but sorry for that, just to show you the kind of factors we put around the table. We work with local communities, with the local authorities, the health district team, the environmental protection body, farmer cooperative, pastoral organization, and as well with a local organization with preventing deforestation. So we put all those people around the table and we try really to identify what are their priority in terms of solution and to be addressed. How we work, what we bring as Solthis is really our capacity to put all those people together and make them work, putting the money to allow that to happen because it's needed for people to travel, come to those meetings and workshops. So we've started by a mapping of actors. That's how we identify the people who should be there in this project. We facilitate workshop, exchange. We do the administrative part of the discussion. And we also put some effort to have diagnosis on specific technical issues that people have identified as a problem for them. I will give two examples and they will come back in the few minutes I'm presenting that. The first one is pesticides, because they really identified that this was an issue. There is black market, especially in Senegal, to provide pesticides. So you know that pesticide is not good, but imagine about fake pesticide, it's even worse, and it has impact for also the crop, the animals, and the human. So we work on it, and we work especially on the analysis of the supply chain of pesticide to see how we can improve it and make it more, let's say, climate friendly. We also try to gather data on antibiotic resistance. It has been mentioned, I think, by you, AMR, and by Vanina. So this is to feed the discussion that those actors will have around, those issues. Then, based on the priority they will identify, we try as much as possible to do capacity building, to support with the government, with the national bodies, support new sensitization of the people, of the population. And then, I should have mentioned that from the start, there is an enabling environment where we work in Senegal, because there is a One Health High Council, Au Conseil One Health. And it's directly linked with the presidency. So AVSF, who is leading the policy and advocacy part of our work, is permanently discussing with this High Council, who has some decentralized body as well. In Casamance, there is one. And they try to bring what we see through this project, and they try to make policy change through recommendation to this government. So from local to global, we try to bring changes. Preliminary concrete outcome. This project is a 3-year project, and we are at, let's say, the middle of the project. Maybe we did more than 1 year and a half, but in terms of implementation, we are at the middle of the project. The main things that we can say today, I called someone that is in Casamance. It's a Senegalese. He's working for Solthis, and I called him yesterday, and I told him, please give me 2-3 things I can say to the students tomorrow, making sure I am up to date. If someone of you go to Vélingara, where we have the project, you won't have things that I don't know. So the first thing is, it's not easy. It's a complex process. Let's be clear. And I mean, that has been mentioned by you, Vanina, and others. It's very difficult to raise attention and to break silos and make sure people are working together. So the farmer will talk about his farming problem. The health worker will talk about his problem. Finding common problems and common solutions is really a challenge, and that's what we face. And we are quite worried about our capacity to really deliver changing, impacting project with the community on that. We have to be clear. But then the first thing that came out, and sorry I'm a bit long, I will take 1 or 2 minutes. The first thing that was identified was the waste management and the sanitation and water. And you mentioned it, Luis, globally for the health sector. It's true as well at local level. And it's hard to think on specific and very difficult thematic when the basic problems are not solved. So today people are telling, okay, you want to talk about One Health? We want to organize our wasting management system. So that's the first thing we are doing, and I'm sure on that we'll be able, that's what we call WASH project, I'm sure on that we will be able to have result. Second thing, and I mentioned it already, is pesticide. And here, it's going to be a long process, but I think we're going to go somewhere, and we try more and more to have a transition to agroecology approach, and making sure there is, as much as possible, a reduction of the use of pesticide, also because farmers are asking for it. Because the interest of being a farmer is that you're also a human, and your kids, if they have problems, are still human who have problems and consequences of what you do. So when the problem and the solution are in the same area, it's more easy to sensitize people to those problems. Antibiotic resistance as well, and it's quite an issue, this one, because it's very difficult in this context to identify, what happens. So we've started a study, but we will see how it goes, and probably that's at the central level with the government that we can have change on that. Luis knows I'm very, very talkative, so I told him I will keep it short, so I have to keep my promise. I'll stop there. What I want to tell you is, as a conclusion, it's the beginning of something, what we do there. It's trying really to discuss and see how we find solutions that can be sustainable because they are community-based. They have been identified by the people we are working with. We don't come with any solutions. We come with a process. If you want to know the end of the story, you definitely need to follow what we do and go on the Solthis website, and you can be part of the Sol team, that is our comité de soutien, so you will be welcome for that. But I don't need you to be in Solthis. I need you to be outraged about what happens now. And I need you, if 1 or 2% leave the room thinking, okay, I need to act on that. That's very important. And I think, Vanina, you were great in the way you said it. We created the problem. They pay for the consequences. And we don't support enough how we can answer to that. So thank you very much. Be concerned, be engaged, and we'll be happy. Thank you very much.
Bravo.
So thank you, Serge. I was wondering, based off of your experience in Solthis and the rest of your career, what the key priority, concrete action would be, in your opinion.
Thank you. I thought I was over. I sent the microphone and everything. A lot of theater. Thank you. I think a lot has been said already. The impact on the zoonose, the impact on all health issues, the shock. Maybe 1 or 2 things that we didn't mention enough, even if Vanina was clear on that, is the shock, the climate shock. All the events are more have a more frequent, are higher in terms of impact. So we really need to tackle that. The second thing that has not been mentioned is for sure nutrition and food security. The impact is high. It's horrible what happened today. If you go and look what happened in West Africa, in Somalia, everywhere, drought is creating real big problem. And if you are not well nourished, you won't be healthy. So how I think we should answer to that? A lot has been said, but there is something else. We have to create sustainable system. Luis mentioned that Solthis is working on health system strengthening since a very long time. We started working on HIV, and then we realized that to have a sustainable response to HIV, we need to have strong public system. I think you all saw what happened with COVID, and the main thing that was needed for COVID was hospital, health worker, capacity to have diagnosis, health information system. All those are the building block of the health system. So finally, maybe I'll be a bit provocative on that, but what we need to do is business as usual, on health system strengthening, but with a higher dimension, health system strengthening and community support. And making sure what happens also at community level, their capacity to identify the early warning system, identify any new infection, any new problem, and that they have this strong link with the health system, with the central level, Ministry of Health and so on, will be key. And that's how we try to address, apart from the project I presented, that's how we try to address those issues. Thank you.
Thank you, Serge.
So next we have Marisa Per.
No, this is,
sorry.
Sorry, Savannah, no, it's because, we talk about resilient health system that are very important to address climate change. And we will be a little bit resilient too tonight because Marisa had an issue, so she's not connecting.
Okay.
So sorry for that. But it doesn't matter because we took a little bit more time than expected, and what we wanted was to have time with you to let you the possibility to ask questions. So you have two mics, one there and the other one there, and it would be wonderful if you can go to ask the question to the panelists. I think that Neelika, I sent a message saying you don't have to leave, Neelika, but it was around midnight in Thailand now, so it's a little bit tricky. Well, if she comes back, she will respond. If not, I will try to do it for her. But you have, of course, Vanina and Serge. So please, start your question.
Is it on? Okay. Why aren't we talking about an urgent change of our food system going plant-based? There's facts. I'm not talking about vegan animal rights activists here. I'm trying to actually refer myself to the plant-based, the EAT Lancet summary report from 2019, page 16. It also says, this report states that it's not just about reducing the consumption of animal products, but just cutting them. If not, we're not gonna be able to keep it lower than 1.5 degrees Celsius and all that. I mean, this needs to be taken seriously. It's just not an individual preference or whatever. It's just like, as a society, we need to lean to go towards that goal.
No, absolutely. Very good question. Maybe we're going to take the second question, and I let you then both respond to that. Please.
Okay. Yeah, thank you for your presentation. Very interesting. I have a question regarding to cryosphere. I don't know how to pronounce that. Cryosfera in Spanish. Cryosphere, maybe?
How do you say it in Spanish?
Cryosfera.
Cryosfera.
Yeah.
I'm from Chile, but I speak Spanish. But cryosfera, like cold. Cryo.
Yeah, the ice.
Okay.
Cryosphere, I think.
All right.
The importance of cryosphere in climate change and health, I think it's a real issue and maybe a threat. And if it's being addressed in any circumstance, I'm sure that it's not on point in the agenda of COP of anything, but it's like the ice is melting, so probably it's going to be an issue soon, or should be already. And my other question was about, you mentioned, Vanina, I'm sorry if I'm pronouncing that wrong, finance. For example, should we take an approach of solidarity on finance? Obviously, or we should like point out to the emitters. And yes, thank you.
Okay, and but we can take a third. Stella, please. No, please.
Regarding finance, I was wondering as well, if we're going to have, sorry, can you hear me?
Yes,
okay.
Better now.
Regarding finance, I was wondering as well, so you talk about philanthropy and about why it's needed, and you talked about public health system and the need to have infrastructures, and I was wondering, I feel like, and we saw that with COVID, that the current system we have now won't be able to help everyone at the same time. So how should we improve our system, like how you conceive global health in the future? So should we depend in like a public system for everyone? Should we depend in like philanthropic help?
Do you want to go or?
No, just a question as well. Sorry.
Please.
Just regarding what you said about it, like the colonial aspect of like One Health, and just like obviously there's not one answer, but just like how could we decolonialize it a little bit? Like, well, I'm from Latin America, and in Latin America we have people such as Bolsonaro who clearly like are not very like very decolonial, but not very into like planetary health, let's say it like that. Yeah, just like how can we like start decolonializing it?
Just easy questions for you. So I'm very happy that I'm chairing and not responding. Who would like to start? Vanina?
So let's make this a conversation, guys and ladies. Please, Savannah, join in.
No, take it
because
along.
I think it'll take many perspectives. First, on the plant-based. So in my events, for instance, I'm trying to ensure that there is no meat because every gesture counts, and I think it's indeed the simplest solution towards climate transition. It's been documented. You have the report probably open here, and indeed it's going to be doing two things. One, reducing CO2 emissions after travel, after plane travel. Consumption of red meat, it's okay for poultry, but consumption of red meat is the single most important emitter of CO2. So you're absolutely right in terms of reducing CO2 emissions, therefore mitigation, huge net gain. And the other thing that it's doing is actually reducing zoonosis, so the animal health transmitted diseases, which unfortunately are becoming more frequent with the elevation of temperature. And in the milk, the yogurt, everything, the dairy products that are consumed, come more diseases. So it's a big, especially here in the heart of France, it's a big change in terms of cultural adaptation. But I think when we discuss adaptation, it's indeed one thing that has been missing, and that's this cultural adaptation. And again, I'm not going to offer any solutions tonight. I'm sorry, but it takes all of us to, I think first quietly and then a bit more forcibly, invite others to join in thinking about what is it that we can do at our own level. Because often people are completely at loss in terms of understanding what is it that they can do at their own level. It's, in my mind, I think you're absolutely right, one key solution. I don't want to know if you want to comment on that. Plant-based, no? Okay, so I'll take other questions. Okay. Luis, Savannah, no comments on plants? You want to eat your red meat still?
No, just on the Lancet report that was launched today, I had the time to... No, I know, but just to let you know, because I read it in the train this morning coming here to Paris, they talk about this, and they said compare to the studies they did 5 years ago, the situation, it's quite worse today. So it is a sort of warning here, saying we have been bringing the evidence, as you said, and unfortunately the situation is not improving, and it's even getting worse. That's clear, and it's documented, it's evidence-based. For me, the solution, and I agree with you, we don't have too much, but first of all, it comes from you. Because the difference, I mean, I'm from Latin America to Chile, so eating meat, it's impossible to imagine the weekend for my generation without doing a barbecue. My son today look at me saying, you are completely out of everything, and how you do that, you're stupid, and you of course you can live without your barbecue, that is an old thing for old people like you, and blah blah blah. So I'm like, oh, okay. And so for me, yeah, it is something also that will come from some generational changes, because you will bring that. It's not the only one, and we cannot wait maybe for a generation to change, and we need to do our part for sure. But I would say in some cultural elements, etc., there is something around this. I don't know. Yeah.
It's just the facts of the
Exactly. You agree. No, absolutely. Absolutely. Agree.
Louis?
Agree.
No, just one word. Sorry if I have my hat of humanitarian worker, but I mean...
But are you Latin American? Because if
I am not
you
Latin American.
Cannot talk,
I don't know if I'm eating meat, but there is someone from my team in the room, so I cannot lie. So, no, just one word is the problem of the vulnerable population we are mentioning in Africa is not even knowing what they eat. Is making sure they got the basic calories they need per day to survive. And that's also a question. And you're right in terms of the cost of food. The cost of creating food is also a question, and the economic, and maybe I'm anticipating on the other question, the food system, the way we have our food system today, and maybe some people realize, I don't know, that mustard de Dijon, a French city, is coming from Canada. Cereals that we eat in Africa is coming from Ukraine. So that has also a big impact on the climate and on the environment. So yes, there is this question of meat, and you're right. But there is also, for the people we are working with, the question of just having access to basic, not even meat, basic needs in calorie, and also drinkable water, simple drinkable water for their needs per day.
Maybe let's move to the other question.
Yep. So the cryosphere, it's a fact. The glaciers are melting. Again, the Pakistan, Neelika was alluding to this, the Pakistan floods were caused 100% due to the glaciers melting. I'm no climate expert. Luis was asking what was my background at the beginning, because I'm not a medical doctor, I'm a lawyer by training, so it shows you that you can work in health and know nothing about health. That's something maybe of a provocative statement again, but you can learn a lot through different lenses. And I will stop there because I'm not going to pretend that I have key facts on what it's doing, but it's definitely an issue.
Yeah. My micro failed when you were talking about being health worker working on. No, I don't have much to add on that as well. Please.
So, Savannah, nothing on the cryosphere. Okay. Next question. I think we can take the two of them at the same time. Is about financing. So here I want to go back to COVID because we've all spoken about it, and clearly it's been a repetition for what is coming, with more heat waves, more floods, more fires, and it's really been a demonstration of what can go wrong and how the financing is not aligned when things go wrong. Fortunately, those of us that live in wealthier countries have been able to access vaccination quickly enough, but where I'm getting at is the fact that without blended financing, without blended capital, without hybrid ways of financing health, it is indeed not sustainable, meaning we cannot longer keep the healthcare systems that we have known in most of continental Europe. And in the US, it's largely known that it's the most inefficient healthcare system in the world, despite the most expensive. Why am I saying this? I'm saying this because philanthropy is going to play a tiny, tiny real role, but it's going to be philanthropy. It's going to be venture capital. It's going to be social impact investing. It's going to be more and more investment, again, in public-private partnerships that can take the risks of developing drugs that are not necessarily going to have a market, that we are going to find some of the solutions. So that's what I wanted to say. We are starting to work with new actors in financing, again, climate action and health resilience, only on this. But it's going to be true for a lot of various global health elements. And I think in there, you probably have a thing or two to say, because you know this topic very well as well.
Yeah, but less about finance, let's say, but more about how we try to invest on access, etc. I mean, we can maybe come back, but on this point. But Serge, because I know this is something you work a little bit on that.
Yes, on financing, probably one of the new role that we try to have as NGOs, and that's why we are very happy to work also with Fondation AS, with government, I mean, with all actors that are involved there, is advocacy. Is really that what we do, I mean, since years, is trying to, and I will answer maybe on decolonization of it just after it will link really with what I say here, is really to be field evidence-based, demonstrate what works, and push international donors to invest where it matters. And also, let's not be naive, also looking at what happened in the country where we intervene and making sure, and you mentioned a lot of investment that are needed. I would insist on the domestic funding and the fact that there is a need that those countries, especially in Africa, in Southeast Asia, those countries are putting tax to fund their own system. And they don't use only the international aid, because decolonization of aid is also based on investment in country by the countries on their health per capita with a good level, and also with a good governance. Because one of the problems you have, you can put more money if things are not working properly, then the health system will collapse anyway. That was the main thing maybe I wanted to add on what you said.
Savannah, you had a comment? No?
Yeah, maybe something that it's interesting also for you to keep in mind is what we call the common goods here, and is, for instance, it's difficult sometimes if we talk about health in general, if we talk about health system, or if we talk about, for instance, knowledge bring by research and development, but those elements are not owned just by the public sector or the private sector. There are things that are common goods, as the Amazonian forest, for instance, etc. And now how regional development banks, how national countries, how different stakeholders are trying to work together to make that happen. It's also a challenge, I think, for your generation that would be very interesting, because it needs a completely different governance at the national level, but also at the regional level, that we don't know already how it's going to be, but we know that it's going to be probably one of the main solutions to go when it's about this type of element we're talking here. But again, that could be for a long time.
There was the question on decolonization. I see a lot of people around the mic, but briefly on that, if you allow me, shall I start?
Yeah, of course.
I think One Health is really very interesting in the sense that it brings this view of decolonization of aid. If you remember how I presented the project, few words and be short to make sure we have a dialogue. Localized answer, as local as possible, as international as necessary. Things have to be local. People in the center of decision, making sure the decision is bottom up and is driven by the needs of people, and not something else. I'll come back later. I think we mentioned that already, use field evidence-based. That comes with this idea of needs-based approach. And in terms of funding, we need national actors to be funded. We need public system to be funded. We need to avoid that international solidarity goes to a kind of privatization of the health system, because there are things, to my feeling, that needs to be a common good in terms of the how we can bring the system. And not only, this shouldn't be done only by NGOs like Solthis, international NGOs, or other NGOs that are even in Africa but are international NGOs. You know that there was a commitment in 2016 that more than 25% of the international aid would go to national actors. Today we are at less than 4%. So it goes with other data that you were mentioning, Vanina, in terms of how really national actor can do this.
So maybe
and a quick word on that, maybe, sorry, because it's also a topic that I'm passionate about. On our side, what we've done is to ensure that we could fund a local actor in Bangladesh. It's an organization called Friendship, to give you a very concrete example of how to decolonize climate change. It's indeed evidence, and we're going to fund some of this. It's locally led solutions. It's domestic funding that we can do through sin taxes, like taxes on tobacco, alcohol. It actually works pretty well. And it's joint advocacy. And again, the first projects that we've been funding in Bangladesh, they've been developing those locally led adaptation solutions. And in Bangladesh, because they moved from 1 or 2 floods a year to now 6, 7, 8 times this year, everything wiped away because of the flood, including the healthcare facilities, they've decided that it was best to invest in a boat hospital. Great, makes sense, let's go fund this and then move on. And that's how you can decolonize, by really working on locally led solutions. Sorry.
Absolutely. No, but I really would like to give the space for the question. So yes. Please, I don't know who was the first.
Hi, Hi, thank you for all your comments. I think my question maybe is a little more directed at Serge. Can you hear me? Yeah. So it's about the Solthis approach you talked about. So how basically you have the local actors kind of sitting around the table. And the example you gave in Senegal, it seems like there was political will, especially with the High Council of One Health, I think you mentioned. So my question is this political will a prerequisite to creating a sustainable system? In an ideal world, I mean, yes, it would be great to have it, but I think in some cases that's just not the case, that you have the high level support. And if you don't have that support, what do you do? Can you still kind of utilize the same approach? Or I don't know if there's experiences, projects that, where you've encountered this, so any comments you might have.
Okay, we're gonna take maybe the 3 questions first, and so we do.
Thank you. Thank you for the speech today. My name is Rohit, and I'm from India. I'm doing a course in environmental policy. Sorry, am I audible now?
Yeah, better.
So my question is to Ms. Vanina. So I take a course called Corporate Sustainability, and we learned 2 key pillars on establishing a sustainable corporation, which is attacking sustainability at the core of the operations and using a stakeholder theory rather than a shareholder theory. And I'm wondering, in the context of pharmaceuticals, especially when thinking about new approaches to addressing climate change, what do you see as the key pivotal role of pharmaceuticals in the world of corporate sustainability? I mean, I do take it that philanthropy is an important instrument, but at the core of the operations, what do you think pharmaceuticals should be doing to help change for the better? Thanks.
Yeah, good to have this question from India when it's about pharmaceuticals. And please.
Hi, my name is Ali, and my real thing is trying to get young people to give a damn about their health. So something that really interests me is the fact that young people have become serious ambassadors for climate change. We can't deny it. It's, there's Thunberg at the head of all these movements. But we see at the same time a lot of young people are quite resistant when it comes to telling them what to do to take care of their health. So I was wondering if you could maybe talk to us about initiatives, ideas that you have when it comes to having generationally adapted approaches. You talk about culture, which I really, really appreciate, but also, it's very hard for a young person to have legitimacy in the medical field above all. So what are we doing to help, people prepare for a climate-filled future as well, with us being young?
Okay. So, I think first question for you, Serge, and then Vanina.
Not the second one. I mean, the fact that there is an instance, something at the high level, doesn't ensure that there will be action. That would be my first remark. And sometimes you don't have a body that is national and you have people acting. So, I mean, there is no very specific answer. That's advocacy. That's creating a movement. And I think that's one of the things we want to say today, is that we need to break silos and barriers. We need all actors with their own capacity, their own DNA, to do something for climate and health, being private sector, being activists, being NGOs, being government. And in Solthis, that's how we see things. So to answer to your question, the fact that there is a high commissioner at One Health is at least giving us a target, a good interlocutor to who we can turn to discuss. If that was not the case, what we will do is what we do in other countries. We will talk to the Ministry of Health, to the Prime Minister. But the more important is that you build your cases, and that's advocacy. You build your cases, as I said, based on evidence, and you try to do it with everybody.
Mm-hmm. Thank you. So on the question about what is the pharmaceutical sector response to climate transition, what is pharma doing, what it can do, you're absolutely right in pointing out that philanthropy is, you choose it either the tip of the iceberg or the very bottom of the iceberg, but it's only one and probably small response. I started by explaining that at Sanofi what we've decided to do was to take a 360 approach to climate because it became evident that it was not going to be only through our corporate social responsibility that we could have that holistic approach. Let me explain. What we're doing at company level is the following. One, mitigating our own emissions. 2, adapting our portfolio to climate change. You heard Neelika about the rise of dengue, Zika, chikungunya. That's infectious diseases. It's also true for cardiovascular diseases. It's also true for many other non-communicable diseases. So we need to find the new drugs, or at least the new formulations, to ensure that they're going to be heat stable, they can be easily donated in a once a day or once a month, whatever fashion. So that's what we're developing now. It means a lot of investment, but it's not enough. So what we're doing as well is to work across industry on decarbonizing healthcare systems. You've heard that 5.5% of CO2 emissions are emitted by the healthcare sector. It is a lot, actually, at the global scale. So Sanofi is heading with another company called AstraZeneca, for instance, a partnership called SMI, as Sustainable Markets Initiative. And it's on decarbonizing specifically the patient pathway. What it means from the moment you have a stroke, for instance, and you're transported into an ambulance and all the care that you receive in between, how can we eliminate in as much as possible the CO2 emissions all along the way? And pharma can indeed play a role in how we package our drugs, in how we also enforce the education that's needed around the delivery of the products, do it in more condensed session. I mean, there are many things that we're doing. So that's in a very high level what we're doing. But of course, at company level, we're also working on adaptation and resilience of our own operations. For instance, a lot of excipients come from India. Big problem now with all the supply chains that have been ruptured. So what are we trying to do? We're trying to find plan Bs, because there will be a need for plan Bs when plants are too hot to produce, for instance, and as this has happened also this summer. So that's the type of resilience that we're putting in our own operations. In terms of adaptation, I mentioned about the portfolio for the diseases, but it's also adaptation of our own supply chains. So that's what pharma can do. Again, pharma is not going to work, because it's not a charity, on extending a hand to populations that are already living under the threat of climate change every day. That's where philanthropy comes in. Is it enough? I'll be happy to have you tell me not, and I think you'd be right. Is this something? I think it's a great beginning, because at least it shows that the private sector has woke up, has decided to invest, and in our case it means invest quite decisively in this type of solutions, and that we're inviting others to the table. I spoke about blended capital. I'm now spending quite a lot of time trying to rally other financiers, trying to work in co-financing. The Wellcome Trust is going to invest £75 million into supporting evidence building. We started investing 100K. It's great that the Wellcome Trust is at the table. So that's what we can do together. And again, the power of public-private partnerships that we were speaking about. And on the how to embark youth, Savannah, I'd welcome your thoughts. So it's, I feel for you guys, I want to say, because I think we are placing a disproportionate weight onto your shoulders. My kids are a bit younger than you. I think you've all been sensitized to the phenomenon of eco-anxiety, which is very real. It takes each and every one of us right now not only to wait for youth to wake up. So I know it was not exactly the question. The question is more what can be done to be concrete enough and to ensure that solutions are found. And I want to sum it up in 3 ways that are probably very similar to what can be done for putting more women in leadership positions. And let me explain. I think first, be informed. Know your stats. Know what it is that it means to live in a +2 degrees world. Because it's not an if anymore. It's a when. It's a when we're going to live in this +2 degrees world. And France, by the way, is going to be most impacted. And it's going to be more than 2 degrees. 2, be at the table. It's not okay when we don't have a Savannah with us. It's simply not okay. So in the think tank that we are building, we're putting the voices from young people, and not just the voices, but them, their full bodies, at the table, because it's so important to ensure that, again, everybody is at the table. And 3, as Serge has brilliantly invited you to do, be vocal. Again, it's going to take all of us, and redirecting financing is going to impact you. It's going to impact your well-being. It's not going to be fun. It's not going to be easy. But if you're motivated to do so, then politicians will hear you. Otherwise, why would they do it? Because you'll vote them out. So that's how you can be vocal. And every country has its own issues. But again, you have, if you live in democracies, make the best use of that power.
We have 5 minutes.
Yes, I'll be short. You know,
no. Let me first take 2 questions.
Okay, sorry.
Because we have those 5 minutes, and I would like, and then I give the floor to Savannah, and then we conclude. Okay? So let's go with the 2 questions first.
I will be quick. So basically, you mentioned that it's important to bring every local parties together, the government, the farmers, the environmental activists. But as far as I know, organizations such as DNDi is not profit-oriented. So I'm wondering, like, when you are operating your initiative, what is the motivation that makes you coordinate so many roles together and to promote your idea? Because I see in the developing country, most of them have the mindset in that developing is most important than environment and our mindsetting. So I'm wondering, how do you conquer this gap?
Okay.
And my question is about urban planning, actually. It's an actor that we didn't talk about yet, and I wanted to know how much urban planning can have an impact on NGOs' actions, or even on the climate change and One Health project in general. So, urbanism. Yeah, I know I found the right word, but I'm not sure. So yeah, how this particular area can have a great impact on One Health and planetary health in general, on site and with NGOs' actions.
Absolutely. So we start with you. Just to be simple and for sake of time, the DNDi one, we talk about it on Friday during the class, okay? So I don't take time here to come back on this, and I give more time to the colleagues on the table, but I will respond on Friday, no worries.
I just had a quick comment on your question about pharma. At one of the workshops that we organized at the World Health Summit, we had the Deputy DG Santé for the European Commission. So this is more European Union focused, but he was explaining how the legal power in human health remains in the hands of member states individually, and pharma, animal health, plant health, that remains within the EU. So just that slight difference in legal power is important to understand when advocating for pharma to help support human health initiatives, I think. Just a side comment. And to the question on engaging youth, I mean, there's no pretense here. I'm a student like all of you. But I think we're part of a generation that really feels motivated in the face of climate change and global health. And I'm happy to see all of you at this event, because at least you care about it and you're interested. And I have hope that we can find solutions together.
Yeah, let's finish with a note of hope.
Yeah.
Serge, and then Vanina to conclude, because we have 2 minutes.
I'm not able to answer to urbanism question in 1 minute. It's so complex. I'll be happy to discuss that in another meeting. You can do One Planet, One.
You can take the class of Serge in the second semester.
Yes,
and discuss
you're welcome,
during the
and
whole
we will
semester.
put urbanism, and we'll invite Vanina. Then you can have both of us. I will conclude on engagement. How we do engage people in countries where we work, it's very simple. We go to existing groups. There are young people that organize themselves. So it's more, I have to be clear, it's more on sexual and reproductive health. We do it in Niger, We do it in Guinea. It's not easy country if you know the situation there to engage on those questions of sexual health and early pregnancy and so on. So we do it through what they do, what they use, blog, social network, and we just support them. And that will answer the other question on how you make sure people that you put together want to be together. We do it if they ask for it. We are not going to invite someone who is not interested by the subject. So that's what I call the mapping of actors. We try to look at who is doing what, and then we bring them. Engagement, that's my passion, so we can discuss again a lot in the class. Find your way. I mean, for me, it's a mixed approach. There are things existing. Don't forget there are NGOs like us. We are trying to work. We are trying to find relay. We are trying to have activists. There is a strong, I can give you a lot of examples. You can take one, Oxfam, a lot of existing things. But then I think what would be my conclusion is if you want to do something on that, you have to find your own way, create your own way of engagement. It's not an old doctor, an old male of 50 years old that will tell you how you can change the world. I tried, I'm not sure I succeed. So it's also to you to use your brain to find solutions that will be impactful in 2020. Thank you.
Thank you, Serge. So quick answer on urban planning. I'm no expert, but I was very interested again in this Lancet report that we've mentioned several times. It's actually one of the first figures that they were explaining to explain the scarcity of proactive adaptation, and it's been shown in the response to extreme heat. Basically, since 2020, only 27% of the big cities in the world have built green spaces, because we know that this is the one way to cool cities. Instead of building more green spaces, we have increased air conditioning by 66%. 66%. So, and you all know what air conditioning does in terms of energy consumption and everything. So it shows you that, like plant-based diets, they can be relatively low-tech solutions that we all know about. And as Serge is inviting you to do, we all need to be probably more vocal about, because that's what it's going to take. It's going to take efforts. It's not fun to not have AC and to wait until a park is built next to your apartment. But ultimately, that's the type of solutions that we need. So we started with glimmers of hope in introduction. We want to promise that we give you glimmers of hope. I think a health-centered response to climate change is ultimately what we're inviting you to think about, because it's the way to a thriving future. So think about this. Unite those two topics, think intersection in everything you do.
Thank you, Vanina. And just 2 words. It's funny because I was having lunch with the president of Médecins Sans Frontières today, and I asked her, I said, I'm going to talk about climate change. What do you think here at MSF, etc.? And they said, the hope thing is, first of all, they understood that everything it's about climate change for them. So they cannot just close eyes on what was going there. But second is that medical doctors don't have the solution. They said, tell to your students that we are expecting the profiles you have to bring the solutions on what such a huge organization like MSF can start doing to make things change. The hope is that there is this dynamic, as I said at the beginning, people starting to understand. And second, they are waiting for you, for your profile to do those changes. And third, maybe about the youth, is that what we have been doing is not like the young against we, the old guys, etc. It's how we do that together. And we do that together at home, as I said before, with the my son as your age, saying, we need to change everything at home because it's not going well, and I'm stopping eating meat and things like this. But it's also in the office, in the programs we do, with the young generation pushing, to make things together. So, try to enter into that and really bring your own perspective. So thank you very much to Savannah, Vanina, Serge, Neelika that was there but went to bed, and thank you all of you for being with us tonight. See you soon.